One of the models that's receiving a lot of attention, of course, we know in healthcare kind of what is new is old, or what is old is new, right? A lot of these things have been talked about years ago, and then they resurrect and come back maybe with new names. But CMMI came out with another initiative recently. I believe it was called the Accountable Health Community or something along those lines, but really designed to get healthcare, medical care delivery systems to partner with those who provide social support and social services for patient populations, things like transportation, housing, energy assistance, food assistance, and so forth and so on, what many people would traditionally call the social determinants of health. I'm wondering your thoughts on that. You know, we talk about some of the models that you talked about. They're still somewhat medical system centric. I think this new, again, I'll say new, this isn't a brand new concept, but in terms of CMMI's program, they're really trying to get the traditional healthcare delivery system to work with these other sectors. And when it comes to health, I'm curious as to your thoughts about whether this is really, the way to go. Is this going to get us, if we can pull it off, a lot closer to where we need to be? What are your thoughts on these kinds of models?
Oh, we're strongly interested in these accountable care communities. We think it's the way to go. Most healthcare does not occur in hospitals and doctors' offices. It occurs in communities. We've been convening meetings here in Western Pennsylvania for all the agencies that are involved in creating these communities, everything from Meals on Wheels to free clinics, FQHCs, United Way, different funders. We've been bringing them together around one table to talk about how we could create something like this. It makes all the sense in the world. The interesting thing that happens when we bring these groups together is they typically don't know each other. Here they are, been serving the same clientele for years, the same ultimate mission to improve the welfare for people in our community, yet they've never had connections. One of the things that we're really trying to work on is build data systems. So these groups can begin exchanging information, which would be so helpful in identifying people in need and getting them the care they need when they need it.
Mm-hmm. Yeah, and I imagine conceptually, at least, we could link this back to payment reform, right? One of the things that always puzzles me is, okay, if we were to identify systematically more people that could use additional social services, I imagine a lot of these social service providers are at capacity. They don't have enough resources probably to deal with their existing clientele, let alone, take on additional clientele. But I would imagine from a payment perspective, there's some way to say if downstream we can prevent healthcare expenses, if we can prevent exacerbations, ED visits, hospital readmissions, maybe the savings that we get there could be sort of circulated back, or at least recycled back in part to provide more of those services in the community. And to me, that's what seems to be fascinating going forward, is whether we can get the payment reform part of this, the dots connected across a continuum and across different organizations that, as you mentioned, maybe don't even know each other, let alone have worked together before.
Yeah. A perfect example of that are the concept of community health workers. These are people that typically don't have advanced degrees in healthcare, but can go out into the communities, identify clients, residents in need, and get them the services that are required. We're just starting to do some work with the state of Pennsylvania at promoting community health workers in our region. But the problem is there is no payment mechanism, either through Medicare, through Medicaid, or through the commercial payers, that can make these services happen. So what we like to do, what our role at PRHI is to leverage grant funding or donations or foundations to step up, to make this happen, if nothing more as a demonstration. But then once we've shown the value, then reach out and try to make this, instead of just being a demonstration, make it part of everyday healthcare. I will tell you that we've had incredible success with the Commonwealth of Pennsylvania. The Department of Human Services has been completely engaged with us in making this happen, and the prospects it's going to happen in 2016 and 2017 are extremely high.
Yeah, proof of concept. I think that's a good way. Pilot projects, proof of concept, showing that something can work, measuring it, evaluating it, and then people have more faith to take this to scale and put their dollars with it. It makes a lot of sense. I think we have a lot of that experimentation going on in kind of the healthcare arena. It's been a great conversation. I really appreciate your time and the work that you guys do. I always look forward to the updates that I get from PRHI and seeing you at meetings. So I'll look forward to keeping in touch and following the good work that you do. So thanks very much for joining us today.
It was a pleasure, Dennis. Thank you.